A mother of four teaming up with a local doctor to raise awareness in the fight against breast cancer, which she said made all the difference. Well, October is Breast Cancer Awareness Month, and today a local mother and a doctor coming together to team up with the Society of Nuclear Medicine and Molecular Imaging in Reston to discuss how getting the right test can be life-saving. Cancer fighter Jamil Rivers is joined by Dr. Giuseppe Esposito. He is Chief Nuclear Medicine at MedStar Georgetown University Hospital. We welcome you both, first of all, for being here today. Lots to ask you about this. I mean, this nuclear medicine just sounds very out of this world, right? But yeah, exactly. Let's talk to you, Jamil, first, just about your story and how you came to meet Dr. Esposito and how this all has helped benefit you, obviously, now, and hopefully will help others in the future.
Well, yeah, I was one of those people that was diagnosed with breast cancer, and it was metastatic breast cancer, wow. So stage 4 from the start. I was under the age of 40, so wow. Did not really have the traditional signs or symptoms. And nuclear medicine was key for me getting quality standard of care. I've been living with metastatic breast cancer now for 5.5 years, and it's just really important for using all the innovation and therapeutics that we can have access to get the best care possible. And so nuclear medicine was key in order to make sure that I could identify the best treatment for myself.
So let's ask you, Dr. Esposito, nuclear medicine and diagnostics, how does that come into play and how does that work and help with breast cancer?
Yes, so nuclear medicine is a medical specialty, obviously, that uses a small amount of radioactivity and which we inject into the patients. And these small amounts of radioactivity are attached to molecules, and the nuclear medicine scans can follow this radioactivity, and we can tag the different specific processes, molecular processes, cell processes, including cancer, right? Which was very important in case of Jamil. So these processes, the nuclear medicine scanners can see these processes, and unlike CT or MRI, they're able to characterize the tumor. They're able to see if the tumor is more or less aggressive, and they're able to reveal the presence, like in Jamil's case, of specific targets which can be attacked with the specific treatments. And so nuclear medicine uses these small amounts of radioactivity to do scans and treatment as well.
Are these scans more effective for everyone, or is it case by case?
Again, we use specific molecules for specific cancers or specific characteristics of the cancers. So in general, yes, it's very helpful, adds information to what the traditional CAT scan or MRI can offer. And so not for all cancer, but most cancers, we have a specific target for nuclear medicine imaging.
Wow. So Jamil, tell us a little bit about your nonprofit and how people can connect with you and maybe learn from your story, too, to help them potentially if they are dealing with similar situations.
Yes, absolutely. So I was surprised to learn that Black women were dying from metastatic breast cancer at a 42% higher rate. So the Chrysis Initiative, which is a nonprofit organization that I launched, is really trying to be the equalizer. So making sure that women of color have access to, innovative treatments, understand standard of care, and that whatever barriers are in the way of them getting standard of care are addressed. And we also work with health systems to reveal their blind spots when it comes to bias and racism and how that is prevalent in the healthcare system, and alleviating that so that they can make sure that women of color can access all of the different therapeutics, scans, monitoring, and all of that. And then we also connect patients with coaches who are knowledgeable about standard of care to make sure that they're receiving the treatment that they're supposed to receive. And we have our BC Navi app, which is really kind of like a cancer companion, if you will, to make sure that they're on top of standard of care and have connections to all of our community partners. And they really have a team to provide that type of support to them so that they can learn about, nuclear medicine and other treatments and therapeutics that could benefit them.
I mean, I think it's so important. Obviously, if you get that news, the C word, there's so many emotions run through. So have a source to help you kind of navigate it. So key. You have that nonprofit. Can you give us the site so people can check it out?
bcnavi.com, thechrysisinitiative.org.
All right, Jamil, thank you for sharing your story. Dr. Esposito, thank you for sharing as well today. And obviously, it's important. Hopefully, we can reach some people out there and you can use this to help in your fight if you are diagnosed with cancer.